Golombos. I am a urologic oncologist here at Rutgers Cancer Institute in New Jersey and an associate professor of surgery at the Robert Wood Johnson Medical School. So the proportion of prostate cancer that is thought to be directly attributable to hereditary conditions is somewhere between 5 and 15%. And so germline or genetic testing is really indicated for those men who have a family history suggestive of a hereditary component. So that's really men with a family history of very early diagnosis of prostate cancer, metastatic prostate cancer, or lethal disease, or men with a family history suggestive of breast, ovarian, or colon cancer syndromes. So right now, I would say the most important racial or ethnic consideration revolving around prostate cancer is screening. Your average risk man, most guidelines suggest should begin screening around the ages of 45 to 50. However, for men who are at higher risk, specifically African American men or men with a strong family history of prostate cancer, should really begin screening for prostate cancer earlier at around the age of 40. And I think the other component of kind of prostate cancer where we're seeing an increased role of understanding the importance of race is with active surveillance. So active surveillance is a treatment strategy for men who are diagnosed with what's thought to be low risk or indolent disease. And that's where we watch the cancer with close surveillance with the understanding that if we see a transition or progression to higher risk disease, that we would step in with curative treatment. Studies have shown that African American men who opt for active surveillance are at a higher risk of progressing to more significant disease than their Caucasian counterparts. So one thing that we look at when trying to select appropriate candidates for active surveillance is what's called genomic testing, where we send the cancer for molecular analysis to kind of further understand the risks of being on active surveillance. And I think this is especially important to do when appropriately selecting African American men who might be candidates for active surveillance to make sure that we're pairing them with the appropriate treatment strategy.